was, the first question was, mothers were asking me, can get sick my baby? Can I get sick my baby with if I get the vaccine when they are breastfeeding? The answer is no. The COVID vaccine doesn't have the live virus and doesn't make your baby sick. We're gonna talk later about more about this a little bit more, but I'm gonna go over the questions that they ask me more frequent in my office. Then the other question is, I gonna have problems to having babies in the future if I get the COVID vaccine? No. And the data shows that is no difference between having the COVID vaccine and the normal fertility in women, even in males. There is no problems with the fertility. It doesn't show any difference. The other question, more common question is, does the vaccine have a chip? And I said, no, they don't have anything inside of the vaccine that is gonna go to your body to check what you're doing. More than your phone, that is the one that they can check you. The vaccine doesn't do that. Don't worry. I always tell the patients that don't worry about that. The other question, very common question is, because of the mRNA vaccine, can the vaccine change my DNA? No. And I always explain my patients, well, the parents of my patients, the COVID vaccine mRNA is like you are giving the recipe to your body to create antibodies. The DNA doesn't change with this. It's only like make your body to prepare the antibodies that are gonna be to protect you against the COVID-19. How this work? When you, like example that you can understand, when you're gonna cook something new, you need a recipe, right? Okay, the mRNA is like a recipe for your body. You get the recipe and then the ingredients are in the recipe, and then you prepare the dish that you want to. The same thing with the vaccine. That's the mRNA, what it does to your body. They go to your body, get into the cell, and give the recipe how to protect for the COVID-19, and your body prepare the antibodies. Okay, and then the mRNA part disappear after you have the recipe. Okay, that's one of the most common questions that I have been over these 2.5 years. Then the other question, very common, is what is the most common side effects of the vaccines? The most common side effects of the vaccines are the ones that they happen in all the vaccines: fever, irritation, pain in the side. That's the other question is, which vaccine is better? It's no better vaccine, it's different vaccines. Actually, we have two types of vaccines. That one is the mRNA, that is the Pfizer and the Moderna. And then we have here in the United States, we have the vector vaccine, like this is the Johnson & Johnson. Okay, and we're gonna go talk about this later when we talk about specific the vaccines, what they do. Okay, then the other question is, people die because of the vaccine. That's not true. People don't die because you get vaccine, otherwise we didn't have vaccine. Then the other most common question is, why was done so fast? Why the vaccines were done so fast? Okay, and I explained in the COVID vaccine, or the COVID-19, that is the coronavirus disease that was discovered in 2019. That is a virus that is the SARS-CoV-2. This virus, similar virus, was found like many years past, meaning that the investigation for the coronavirus is being for a long time, but they didn't have enough money or resources to make a vaccine for this. Okay, when the pandemic started, many organisms, many countries, they give a lot of money on fundings to the people, the researchers, to do a vaccine that they can be done like more promptly than the other vaccines. And I make the example to the parents, like why the vaccine was done faster than the other vaccine that they take too many years. Okay, investigations were already there, but there was no funding to create a vaccine. It's like you have a money to buy a land. You buy the land, but now you don't have no money to build your house. But tomorrow you gain the lottery and you have enough money to build your house. You're gonna build it fast. But if you are working without no money, you're gonna have to build it slowly. Same thing happened with the vaccine. That's why that this vaccine, it was done faster than the other vaccines. Okay, now we're gonna go to the next slide. That is, what are the concerns between the different communities with COVID-19 and the vaccine, specifically with our Black and Brown communities? The researchers report that the death rate from COVID-19 is significantly higher in Black, Native American, and Latino communities than the other groups. Why is this? Some factors are underlying medical condition, unequal access to the healthcare service, and jobs that require employees to work closely with the public without any protection. COVID-19 pandemic has highlighted the need to improve medical service, housing, and job opportunities for communities of color. Many concerns have arisen because our communities, these specific communities, have been more affected with the COVID-19 infection. We see that more people have died. And then when the vaccine came across, these people were the more, like all our people were the most hesitant to have the vaccine because they were thinking, oh, they want to give us to us because it's a new vaccine and we can be the guinea pig. It's not like that because this being studied already with many people already and given to many people. What is something that we need to do as a community is educate our community that say vaccines are safe for everybody and we can have it. And I think in many parts of the country, we have seen that Black, Native American, and Latino communities are the rate of vaccination are lower than the others. But we can change that with it, showing them that that's not what they think. And then be open to answer all the questions and concerns. Why we get vaccinated during breastfeeding? Okay, vaccines are safe during breastfeeding. This is a concern of all moms that are breastfeeding has. This vaccine does not pass into the breastfeeding. What happens is that moms think that the vaccine is gonna cross to the breast milk and it's gonna cause problems on the baby, but the vaccine doesn't cross. And then the baby cannot get sick for the vaccine because it's not a live virus on the vaccine. What does the vaccine? The vaccine is gonna help to protect you from COVID-19 and prevent you passing into your baby. What they pass to the baby is the antibodies, and that antibodies can protect your baby. Okay, when you get the vaccine, your body is gonna build immunity. That immunity are gonna be the antibodies. Those antibodies are the ones that are gonna cross to the breastfeeding. Okay, what the studies are showing? Okay, moms that are breastfeeding, normally they create antibodies for anything that she have in the past or the vaccine they have in the past, and they pass to the baby. That's why the babies are protected when they are breastfeeding for the first 6 months of life. Studies show that when the mom receives the COVID-19 vaccine during breastfeeding, they are found in the baby's antibodies against COVID-19. Still more research to do that, more studies to be done. But for the ones that we have, we know that it's safe to give it to the mom and to protect the baby. And personally, when I was in the beginning of the pandemic, my baby, I was breastfeeding. Like everybody knows, health workers, we were the first line to receive the vaccines. My baby was still breastfeeding at that time. I received my first doses of the Pfizer vaccine during my breastfeeding. I didn't have no problems. I didn't have, my baby didn't have no problems. One of the question is that if the milk supply decreased. I didn't have no problem with my milk supply. I was still breastfeeding. Like this is, I received 2 vaccines different because I have a problem with the first one, but this is a different because I have already a allergy to everything, and I have like a allergic reaction to the Pfizer, and then I have to do, and I did the Johnson & Johnson later. We have studies now, Pfizer and Moderna are the preferred over the Johnson & Johnson, unless something like allergies, like in my case. That's why I mentioned my case, because one of the things that we know about the vaccines is that mRNA vaccine, we know that they are secreted, the antibodies faster on the breast milk than the Johnson & Johnson. That's why the mRNA vaccines are the more preferred. But if the mom have an allergic to any component of the vaccine, or they have any allergic reaction like myself, you can have safely the other vaccine. Okay. Here is a picture that I wanted to show, because pregnancy and lactation both can receive the COVID-19 vaccine. It's safe for moms, and it's safe for when they are pregnant, and they are safe for moms when they are doing breastfeeding. If you see the picture, I show the 2 types of vaccines. That we have the mRNA vaccine, that is the Moderna and Pfizer, and we have the vector vaccine, that is the Johnson & Johnson. If you see the other part of the slide, that is the neonatal transfer, you see like in the pregnancy, when the mom is pregnant, that she can receive safely in any trimester, you see that the immunity also passed to the baby. The study showed that when the baby born, like is a study that the moms that they are receive the vaccine during the pregnancy, 58% of baby by 6 months, like, and during 6 months, they have antibody against COVID-19, compared with 8% of moms, 8% of babies that moms got sick for COVID only have antibody, meaning the vaccine, they have more impact on passing antibodies to the baby than even being sick with a COVID-19 infection. And you see also the slide under, that is in breastfeeding, we see all the antibodies that pass to the baby and also protect our babies. They have shown that the breast milk have antibodies that gonna pass to the baby and then gonna protect the baby. The CDC has released new data showing the COVID-19 vaccination are safe for pregnant people. CDC recommend all people who are pregnant, breastfeeding, or people that think about becoming pregnant, get vaccinated against COVID-19 to get the vaccine. I chose this slide because it's very important that the people know that this vaccine is safe during the pregnancy too. The risk of being very sick for COVID-19 during the pregnancy is very high. In the past 2.5 years, I have seen what COVID-19 can do with a pregnant woman. COVID-19 disease, they can cause premature labor, they can cause stillbirth, and they can cause serious problems to the mom that is pregnant and the baby. Something that is very important to say now is, like, let me see. Oh, let me go back. It's important to say like, I know you are scared because you are breastfeeding, because you are pregnant, and people talk about it, people say things about the vaccine, but the best thing that you can do is ask your provider, ask your doctor, ask your OB, ask your pediatrician what they think about vaccine, if it's safe for you, and what vaccine is more safe for you too. Now was the time that I was saying, like, somebody have questions, but I don't know, Jenny or Eva, you have any questions?
Honestly, I just really appreciate your presentation. It was very thorough and detailed, and I really loved your own personal story about you getting the vaccine. I think that's really helpful to not only know someone that got the vaccine while they were breastfeeding, but like a provider that did it. I think that's awesome.
Yeah, when I get the vaccine, obviously in the beginning of the pandemic, I was saying, first I put my, I say, how many months I'm gonna breastfeed my baby? And I said, maybe until he's 1 year. And then COVID came. And I said, okay, maybe I'm gonna postpone more until I get the vaccine, because I was having the hope to have a vaccine and protect my baby. I breastfed him for 25 months, and he was healthy during all that time. And I think like, I understand the parents, the moms that they're breastfeeding be scared. Obviously, when they call me and they said, okay, you can have the vaccine Friday, and I said, okay, I will get the vaccine. Obviously, I have to do my research because I'm allergic to many things. I have to call my doctor too. That's my allergy doctor. And I have to say, hey, I'm going to get my vaccine. What do you recommend? And he say, okay, because you're highly allergic to everything, get you EpiPen just in case. And I did that. I have a reaction to the vaccine. I was in the hospital, I received the vaccine there, but then I came back and I still feeding my baby, and I didn't have no problems with my supply and anything. And then I wanted to still have me protected. And even though like they did test to me to see how my immunity respond, and I will have high response to the vaccine, I mean, I was protecting my baby even there. I decided to have the other vaccine in order to be protected and don't get sick, and don't get sick my baby at home, but also my patients at work. I was thinking my patients, I have patients that they have cancer, they are immunosuppressed, they are newborns, there are babies that they cannot receive vaccine. And I was thinking in everybody that was around me, not only me. But I think it's very important that when you have questions, go to your provider. They will answer all your questions, all your temors, like if you are concerned about something, if you are thinking that somebody told you. Sometimes not everything that we hear in social media or our friends or family is true, because we get scared now, like we are in the era that the social media can be good, but can be bad too. And my recommendation is ask your provider, ask your OB, ask your pediatrician. We don't want to do anything that's going to harm you or your baby. And I can tell you by experience, my patients ask me, Dr. Calvo, did you get the vaccine? I said, of course I get the vaccine. And then I can tell that many of my moms, they got the vaccine and they got protected babies. And I feel so happy when they come and they ask me, I answer all the questions. And then they always ask me, I think it's the first question that said, do you get the vaccine when you were breastfeeding? And I say, yes. And my baby's fine, I'm fine. And it's been already like more than a year and a half that I got the vaccine for me. And now I'm waiting the vaccines for small babies come up and my baby can get his vaccine too. You have any other
amazing? Oh no, I think that was just an amazing story, especially after you had an allergic reaction and you still chose to continue. That's awesome.
Okay. And I think these 2.5 years is being stressful for everyone, but we can stop spreading. Still some COVID around, it's less than before, but we still in there. I mean, we need to still get protected. And I think the only way that we can stop this is to get vaccinated and to get vaccinated and get the boosters and don't be scared.
Thank you so much.